Question 1. An animal behavior consultant is tasked with evaluating a dog that has recently begun showing signs of aggression, specifically resource guarding. The dog displays growling and snapping when its food or favorite toys are approached by family members. Upon observing the dog's behavior, the consultant must consider the underlying causes of this behavior and what would be the most appropriate course of action to help the consultant determine the root cause. Aggression. A. Begin by using desensitization techniques to reduce the aggression while rewarding calm behavior during food or toy interactions. B. Conduct functional analysis to identify potential triggers, including environmental, social, and past experiences, and then design modification plan based on findings. C. Focus on training the family to avoid the areas where the dog shows aggression, ensuring they don't provoke the dog's guarding behavior. Start using punishment-based training methods to discourage the growling and snapping, as this is the quickest solution to aggression. Answer. B. Conduct a functional analysis to identify potential triggers, including environmental, social, and past experiences, and then design a modification plan based on findings. Explanation. A functional analysis is a key step in understanding the cause of any behavioral issue, including aggression. It allows the consultant to assess the environment, previous experiences, and triggers specific to the dog's behavior. This holistic understanding in designing behavior modification plan that addresses the root cause of the problem. Options and C may not address the root cause effectively, and option D promotes an approach punishment-based that is often counterproductive and unethical in behavior consulting, especially for resource guarding, where positive reinforcement and management strategies are more successful. Question 2. Mr. Roberts owns a horse that exhibits extreme fear responses when saddled, resulting in bucking and attempts to run away. He has tried different methods of calming his horse, but none have worked effectively. As an animal behavior consultant, you're hired to assess this situation and create behavior modification plan. Which of the following would be the most effective first step to take in addressing Mr. Roberts' horse's fear-based behavior? A. Use negative reinforcement to desensitize the horse to the saddle by making the horse work harder each time it reacts fearfully to the saddle. B. Begin gradual desensitization process by introducing the saddle slowly in non-threatening environment and reinforcing calm behavior with positive reinforcement. C. Increase the horse's workload in an attempt to reduce the fear by tiring the animal before saddling. D. Immediately punish the horse each time it exhibits fearful behavior, as this will teach it to stop bucking. Answer. B. Begin a gradual desensitization process by introducing the saddle slowly in a non-threatening environment and reinforcing calm behavior with positive reinforcement. Explanation. Gradual desensitization is a widely used technique for managing fear-based behaviors in animals. This involves slowly exposing the animal to the feared object, in this case the saddle, in a controlled environment, gradually increasing its presence, reinforcing calm responses. Positive reinforcement will create positive associations with the saddle. Negative reinforcement, option A, and punishment, option D, are not effective for fear-based behaviors and may worsen the situation. Increasing workload, option C, does not address the fear directly and could lead to further distress or injury. Question 3, scenario-based. Samantha is an animal behavior consultant who has been hired to work with a client, Mrs. Garcia, whose dog has developed separation anxiety. The dog exhibits destructive behavior, excessive barking, and house oiling whenever left alone. Mrs. Garcia is concerned about her dog's well-being and has tried some methods on her own, such as leaving the dog in crate and scolding the dog after returning home, but the has only worsened. Samantha's assessment of the dog reveals that the anxiety is likely due to Mrs. Garcia's unpredictable schedule and past events of the dog being left in kennels. Based on the scenario, what should Samantha's next step be? A. Recommend immediate medication to calm the dog down and make the owner feel more secure. B. Start with classical conditioning techniques to teach the dog that being left alone leads to rewarding experience, such as toys or treats, rather than punishment or scolding. C. Advise Mrs. Garcia to start leaving the dog in different environments, such as daycare, and gradually increase the time alone. D. Suggest leaving the dog in crate for periods of time to help the dog get used to being alone. Answer. B. Start with classical conditioning techniques to teach the dog that being left alone leads to a rewarding experience, such as toys or treats, rather than punishment or scolding. Explanation. Classical conditioning is effective for treating separation anxiety by creating positive associations with being left alone. Using rewards like treats and toys can help the dog feel secure and reduce anxiety. Option 8. Suggesting medication is not the first line of treatment and should only be considered in more severe cases after other methods have been tried. Option C, while useful in some contexts, may introduce additional stress or confusion for the dog if it is suddenly exposed to a new environment. Option D would only worsen the anxiety, as it doesn't address the root cause and may cause further distress. Question 4. Sarah is an animal behavior consultant who has been asked to evaluate a dog that shows extreme fear and avoidance behaviors towards strangers, especially when they try to approach the dog in public settings. The dog was previously adopted from a shelter and has a history of being neglected. Sarah's initial assessment indicates that the dog's fear response is a likely result of past trauma combined with limited socialization experiences. The most effective approach for Sarah to address this dog's fear-based behavior in public: A. Introduce the dog to strangers immediately, using forceful methods like leash correction to ensure compliance with socializing. B. Begin by creating controlled and safe environment, gradually introducing the dog to strangers in calm, non-threatening way, while using positive reinforcement to reward progress. C. Advise the owner to avoid socializing the dog with strangers altogether, as the dog's fear is likely too severe for any change. D. Use negative reinforcement by exposing the dog to more stressful situations to desensitize it quickly to the presence of strangers. Answer B. Begin by creating a controlled and safe environment, gradually introducing the dog to strangers in a calm, non-threatening way, while using positive reinforcement to reward progress. Explanation: the best approach for fear-based behaviors is to use positive reinforcement and gradual desensitization. By creating a controlled environment and slowly introducing the dog to strangers, the consultant can reduce the dog's anxiety while helping it form positive associations. Forceful methods, option A, and negative reinforcement, option D, are counterproductive and could exacerbate the dog's fear. Avoiding socialization, option C, is not helpful as it doesn't address the root cause of the fear. Question 5. A client brings in a rabbit that has been exhibiting compulsive behaviors such as excessive grooming and hair pulling, resulting in bald patches on its body. The owner is concerned that the rabbit's behavior is self-destructive and may be a sign of underlying psychological stress. What is the best first step for an animal behavior consultant to take in evaluating and addressing this issue? A. Use trial and error approach by changing the rabbit's diet and environment without investigating the root causes of the behavior. B. Conduct thorough behavior assessment, including an ethogram, to identify any triggers or patterns, and then create targeted plan based on findings. C. Advise the client to bring the rabbit to veterinarian for medication to address the compulsive behavior. D. Immediately recommend a behavioral punishment to stop excessive grooming and reduce the risk of injury. Answer B. Conduct a thorough behavior assessment, including an ethogram, to identify any triggers or patterns, and then create a targeted plan based on findings. Explanation: a thorough behavior assessment, including an ethogram, a tool used to observe and record animal behavior, is crucial in identifying the specific triggers and patterns of compulsive behavior. This approach allows the consultant to create a targeted behavior modification plan. Option: a lax structured approach and could lead to ineffective solutions. While veterinary consultation, option C, is important if health issues are suspected, it is not the first step in a behavior issue unless a medical cause is confirmed. Option D, using punishment, would not address the underlying cause and could increase stress and worsen the behavior. Question 6. Tommy has a dog that exhibits aggressive behavior towards other dogs during walks. The dog lunges, barks, and growls whenever it encounters another dog, often pulling the owner in the direction of the other dog. Tommy is seeking professional advice on how to manage and reduce this aggression. As an animal behavior consultant, which of the following approaches would be most effective in addressing Tommy's dog's aggression? A. Immediately start corrective training by using an electronic collar to control the dog's lunging behavior. B. Begin behavior modification plan that includes positive reinforcement and controlled exposure to other dogs, while gradually decreasing the intensity of the dog's reaction over time. C. Advise Tommy to avoid walking the dog in areas where the dogs are present to prevent the behavior. D. Focus on rewarding the dog when it aggression towards other dogs, as this will help the dog learn how to defend itself. Answer: B. Begin a behavior modification plan that includes positive reinforcement and controlled exposure to other dogs while gradually decreasing the intensity of the dog's reaction over time. Explanation. The most effective approach for managing aggression is behavior modification that includes controlled exposure to the trigger, other dogs, and rewarding calm behavior. Gradual desensitization helps the dog become less reactive over time. Collars, option A, and rewarding aggressive behavior, option D, are not humane or effective strategies. Avoiding other dogs, option C, does not address the root cause of the aggression and may reinforce the dog's fearful or reactive behaviors. Question 7. Marissa works as an animal behavior consultant and is consulting with a client who owns a cat that exhibits territorial aggression, particularly in areas where other pets are present. The cat becomes aggressive when other animals enter its space and shows a variety of aggressive behaviors such as hissing and swatting. The client has tried separating the animals, but the aggression continues. What is the most appropriate course of action for Marissa to indicate? I suggest using punishment to curb the cat's territorial aggression, such as scolding or spraying water when the cat shows aggression. B. Recommend gradual and systematic process of reintroducing the animals in controlled and neutral environment while using positive reinforcement to reward calm behaviors. C. Advise the client to keep the cat isolated in separate room permanently to prevent aggression from escalating. D. Suggest that simply ignore the aggression as it will eventually subside on its own without intervention. Answer. B. Recommend a gradual and systematic process of reintroducing the animals in a controlled and neutral environment while using positive reinforcement to reward calm behaviors. Explanation. The most effective approach for territorial aggression is gradual reintroduction in a neutral environment combined with positive reinforcement for calm behaviors. This helps reduce the cat's territorial stress and allows for more harmony. Relationship between the animals. Punishment, option A, is ineffective and can escalate aggression. Isolation, option C, may temporarily prevent confrontations but does not solve the underlying issue, while ignoring the behavior, option D, will not address the aggression and could result in worsening behavior. Question 8. Laura is working with a dog that has developed separation anxiety, resulting in destructive behavior and vocalization whenever its owner leaves the house. The dog has been through multiple failed attempts at training with no progress. The owner is now seeking a more advanced approach to help alleviate the dog's anxiety. What is the most effective method Laura should recommend for managing the dog's separation anxiety? A. Use combination of punishment and negative reinforcement to reduce the destructive behaviors whenever the owner leaves. B. Implement behavior modification plan involving gradual departures and reunions, increasing the duration of separation slowly while reinforcing calm behavior. C. Immediately start using medication prescribed by a veterinarian to calm the dog before attempting any behavior modification techniques. D. Advise to avoid leaving the dog alone entirely to prevent anxiety, ensuring the dog always has company. Answer. B. Implement a behavior modification plan involving gradual departures and reunions, increasing the duration of separation slowly while reinforcing calm behavior. Explanation. Gradual desensitization is the most effective technique for separation anxiety. By slowly increasing the time the dog is left alone and reinforcing calm behavior, the dog learns that being alone does not lead to negative experiences. Punishment, option and isolation, option D, are not effective methods and could exacerbate the dog's anxiety. Medication, option C, can be used in extreme cases, but it should be combined with behavior modification techniques, not serve as the sole intervention. Question 9. Julie has a ferret that has recently started exhibiting signs of excessive digging and burrowing in its cage, which has caused concern regarding its well-being. Julie is unsure whether this behavior is a sign of stress, boredom, or another underlying issue. As an animal behavior consultant, how should Julie proceed with this case to accurately assess and address the ferret's behavior? I advise Julie to simply ignore the behavior, as it may be a normal part of the ferret's behavior and will resolve on its own. B. Recommend an immediate change in the ferret's environment, such as providing additional burrowing material, and observe whether this reduces the behavior. C. Conduct thorough assessment of the ferret's behavior, including observing for other signs of stress or discomfort, and then make recommendations based on findings. D. Suggest Julie start punishing the ferret for digging in its cage, as this is disruptive behavior. Answer. C. Conduct a thorough assessment of the ferret's behavior, including observing for other signs of stress or discomfort, and then make recommendations based on findings. Explanation. Thorough behavior assessment is crucial to understanding whether the ferret's behavior is due to stress, boredom, or medical issue. Simply ignoring the behavior, option A, may allow the issue to escalate, while changing the environment, option B, may help. It's important to understand the root cause of the behavior before making changes. Punishing the ferret, option D, will likely worsen the behavior and could lead to additional stress. Question 10. Kara has a horse that shows signs of fear-based behavior, including flinching and trying to escape whenever it is saddled or approached by the trainer. The horse had a traumatic experience with a previous owner, and Kara is concerned about the long-term effects of this past trauma. As an animal behavior consultant, what would be the best initial approach to helping Kara's horse overcome these fears? A. Immediately start desensitizing the horse by exposing it to saddling and approaching in a highly controlled manner, using positive reinforcement to reward calm behavior. B. Advise Kara to leave the horse alone for several weeks to allow it to recover from the trauma, avoiding any interactions or training during that time. C. Use harsh training technique, such as forcefully holding the horse in place during saddling to demonstrate dominance and stop fearful behavior. D. Recommend increasing the intensity of the training sessions to overwhelm the horse and force it to confront its fear more quickly. Correct answer. A. Immediately start desensitizing the horse by exposing it to saddling and approaching in a highly controlled manner, using positive reinforcement to reward calm behavior. Explanation. Desensitization is the most effective method for addressing fear-based behaviors, especially in animals with a history of trauma. Gradual exposure to the feared situation, paired with positive reinforcement, helps the animal form positive associations, reduces anxiety over time. Avoiding training, option B, will not address the underlying fear. Harsh methods, option C, and increasing training intensity, option D, can increase stress and worsen the behavior. Question 11. Ellie is an animal behavior consultant working with a family who has a cat that has started urinating outside the litter box, particularly on the family's furniture. The cat has always been litter box trained, but has recently started exhibiting this unwanted behavior. The family is concerned about the cat's health and the potential for permanent damage to their belongings. What is the most appropriate course of action for Ellie to take? A. Recommend an immediate medical checkup to rule out any underlying health issues, as changes in litter box behavior may indicate urinary tract infection or other medical condition. B. Advise the family to punish the cat by using spray bottle when it urinates outside the box to stop the behavior. C. Suggest that the family clean the areas where the cat urinates with strong-smelling cleaning products to prevent the cat from marking there again. Advise the family to reduce the size of the litter box to make it less comfortable for the cat, encouraging it to stop urinating outside the box. Answer A. Recommend an immediate medical checkup to rule out any underlying health issues, as changes in litter box behavior may indicate a urinary tract infection or other medical condition. Explanation. Changes in litter box behavior can be indicative of medical issues such as a urinary tract infection and should be addressed by a veterinarian first. Punishing the cat, option B, or using strong cleaning products, option C, can stress and worsen the behavior. Reducing the litter box size, option D, may make the problem worse by causing discomfort. Question 12. John is working with a dog that exhibits destructive chewing behaviors, particularly when left alone in the house. The dog chews on furniture, shoes, and other household items, even though John provides the dog with chew toys and other enrichment. John is seeking advice on how to address the dog's behavior. As an animal behavior consultant, what would be your primary recommendation to help John reduce the destructive chewing? Advise John to continue providing chew toys and increase the dog's physical exercise, but also implement punishment-based approach, such as scolding the dog when it chews on inappropriate items. B. Recommend starting behavior modification plan that includes crate training, regular exercise, and desensitization to being left alone, while also providing appropriate alternatives for chewing. C. Suggest that John confine the dog room where it cannot reach any furniture or personal items, ensuring that the dog does not have the opportunity to chew. D. Recommend that John ignore the behavior, as it is likely just a phase that the dog will eventually outgrow on its own. Answer. B. Recommend starting a behavior modification plan that includes crate training, regular exercise, and desensitization to being left alone, while also providing appropriate alternatives for chewing. Explanation: a comprehensive behavior modification plan that addresses the underlying causes of the chewing behavior, such as separation anxiety or boredom, is most effective. Crate training helps prevent destructive behaviors when the dog has supervised. Physical exercise and mental enrichment are also key components of reducing chewing. Punishment-based approaches, option A, and confinement, option C, are not long-term solutions and do not address the dog's underlying needs. Ignoring the behavior, option D, may lead to worsening of the issue. Question 13. Lisa is working with a dog that exhibits fear-based aggression towards people, particularly strangers who approach the dog too quickly or in an unpredictable manner. The dog has not bitten anyone but shows signs of fear aggression such as growling and lunging when faced with unfamiliar individuals. Lisa is unsure how to approach this situation in a safe and effective manner and weighs the most appropriate strategy for Lisa to use in it. The dog's fear aggression. I advise the owner to keep the dog isolated from strangers permanently to prevent any potential incidents. B. Begin structured desensitization and counter-conditioning plan using gradual exposure to strangers while rewarding calm behavior to reduce the dog's fear and aggression. C. Recommend that the owner use prong collar and corrective training to stop the growling and lunging behavior when the dog reacts. D. Suggest that the dog's owner avoid the dog in public spaces to eliminate the possibility of encounters with strangers. Answer: B. Begin a structured desensitization and counter-conditioning plan using gradual exposure to strangers while rewarding calm behavior to reduce the dog's fear and aggression. Explanation: desensitization and counter-conditioning are the most effective strategies for addressing fear-based aggression. Gradually exposing the dog to strangers while rewarding calm behavior helps the dog form positive associations and reduces fear. Isolation, option A, and avoidance, option D, are not long-term solutions and could increase the dog's fear and anxiety. Using corrective tools like prong collars, option C, can worsen fear and aggression. Question 14. Mark is working with a parrot that has started screaming loudly whenever it is placed in its cage, particularly when the door is closed. The parrot also screams when it is left alone in a room for extended periods of time. Mark is concerned that the screaming may be due to boredom or distress. What is the most effective approach Mark should take in addressing the parrot's screaming behavior? And advise Mark to ignore the screaming behavior, as the parrot will eventually learn that this behavior gets no attention and will stop on its own. B. Recommend that Mark provide more mental stimulation and social interaction for the parrot and use positive reinforcement to reward quiet behavior while addressing any potential anxiety issues. C. Suggest that Mark punish the parrot by squirting water from spray bottle when it screams to stop behavior. D. Recommend that Mark confine the parrot to smaller cage with fewer toys and distractions to prevent it from becoming overstimulated. Answer: B. Recommend that Mark provide more mental stimulation and social interaction for the parrot and use positive reinforcement to reward quiet behavior while addressing any potential anxiety issues. Explanation: providing mental stimulation, social interaction, and positive reinforcement for quiet behavior is crucial in managing screaming behavior in parrots. Boredom and anxiety are common causes of excessive vocalization. Ignoring behavior, option A, might not be effective, as the parrot may escalate the behavior to get attention. Punishment, option C, can increase stress and worsen the problem. Confined spaces and reduced stimulation, option D, could exacerbate boredom and anxiety, leading to more screaming. Question 15. Sarah is an animal behavior consultant working with a family that has a dog, Max, who exhibits possessive behavior over food. Max growls and snaps at family members when they approach his food bowl, even if they are just trying to refill it. The family is concerned about the aggression and they are looking for a way to address this issue without using force or harsh methods. What is the most appropriate course of action for Sarah to recommend? Managing Max's resource guarding behavior. A. Advise the family to practice desensitization by gradually approaching Max while he is eating and rewarding him with treats for calm behavior to reduce the guarding response. B. Suggests that the family take away Max's food immediately when he displays aggression in order to show him that resource guarding is unacceptable. C. Recommend using muzzle during mealtimes to prevent any potential bites and avoid any confrontations during feeding. Recommend that the family avoid any interactions with Max when he is eating, leaving him to eat in peace without any interference. Answer A. Advise the family to practice desensitization by gradually approaching Max while he is eating and rewarding him with treats for calm behavior to reduce the guarding response. Explanation: desensitization is the most effective and humane method for addressing resource guarding. Gradually approaching max while he eats and rewarding calm behavior with positive reinforcement helps to reduce anxiety and reinforce positive associations. Weigh the food, option B, can increase anxiety and worsen the behavior. Using the muzzle, option C, addresses the symptom, not the root cause, and doesn't promote behavior change. Avoiding interaction altogether, option D, may reduce the likelihood of guarding in the short term, but doesn't address the underlying behavior. Question 16. Liam is consulting with a client who has a cat named Whiskers. Whiskers has started to show aggressive behavior towards the client's other pets, particularly during playtime. The aggression appears to be territorial in nature, as it typically occurs when the client's other pets enter Whiskers' space. Liam is tasked with developing a plan to address the aggression while minimizing stress on Whiskers and the other pets. What approach would be the most effective to this territorial aggression? A. Advise the client to isolate Whiskers from the other pets and never allow them to interact, as separation will prevent conflict and reduce stress. B. Recommend the gradual reintroduction of Whiskers to the other pets while using positive reinforcement to reward non-aggressive behavior during interactions. C. Suggest that the client reprimand Whiskers with spray bottle whenever it shows aggression toward the other pets to stop the behavior immediately. D. Recommend that the client provide Whiskers with larger territory and more resources to reduce competition while allowing all pets to interact freely. Answer. B. Recommend the gradual reintroduction of Whiskers to the other pets while using positive reinforcement to reward non-aggressive behavior during interactions. Explanation. Gradual reintroduction and positive reinforcement are the most effective strategies for addressing territorial aggression. This allows Whiskers to adjust to the presence of other pets in a controlled manner while reinforcing positive, calm interactions. Complete isolation. Option A could increase territorial behavior and stress. Reprimanding with a spray bottle, option C, may increase stress and worsen the aggression. Simply giving more space, option D, may not address the behavioral root of the aggression and can lead to further territorial issues. Question 17. Megan is working with a dog that displays extreme anxiety when left alone in the house. The dog exhibits destructive behaviors such as chewing furniture and urinating inside even though it has access to toys and is regularly exercised. Megan suspects that the dog's anxiety is related to separation anxiety. What is the most appropriate course of action Megan should take to address this issue? I advise the owner to ignore the dog's anxiety and allow the behavior to subside on its own over time. B. Recommend the owner gradually desensitize the dog to being alone by increasing the duration of separations in gradual and controlled manner, rewarding calm behavior. C. Suggest that the owner crate the dog for extended periods of time to prevent the destructive behavior and teach the dog that being alone is not dangerous. D. Using punishment-based approach, such as using an anti-bark collar or spray to deter the dog from exhibiting anxious behaviors. Answer. B. Recommend the owner gradually desensitize the dog to being alone by increasing the duration of separations in a gradual and controlled manner, rewarding calm behavior. Explanation. Gradual desensitization is a well-established method for addressing separation anxiety. By increasing the duration of separations and rewarding calm behavior, the dog learns that being alone is safe and not something to fear. Ignoring the behavior, option A. Using punishment, option D, will not address the anxiety and could make the behavior worse. Crating the dog for extended periods, option C, is not an ideal solution and can exacerbate the anxiety over time. Question 18. Jessica is an animal behavior consultant working with a family who has a cat that has recently started exhibiting excessive scratching behaviors on the furniture and carpets. The family is unsure why the cat has started this behavior, as it has always had scratching posts available. What are some possible causes of this change in scratching behavior, and how should Jessica recommend the family address the issue? A. The scratching behavior is likely due to boredom or lack of enrichment, and Jessica should recommend increasing the cat's playtime and providing additional scratching posts in different areas of the home. B. The cat may be suffering from an injury or pain, and Jessica should recommend an immediate veterinary checkup to rule out medical causes. C. The cat may be marking its territory due to stress or change in the home environment, and Jessica should advise the family to reduce stressors such as loud noises or new pets. D. The cat may simply be engaging in normal feline behavior, and Jessica should advise the family to allow the cat to scratch as much as it wants. Answer A. The scratching behavior is likely due to boredom or lack of enrichment, and Jessica should recommend increasing the cat's playtime and providing additional scratching posts in different areas of the home. Explanation. Scratching is natural feline behavior, but when it becomes excessive, it can be a sign of boredom or insufficient environmental enrichment. Increasing playtime and providing more scratching posts in different locations can help redirect the scratching behavior to appropriate areas. Veterinary checkup, option B, is always a good idea if there are concerns about pain or injury. Reducing stress, option C, may be helpful if there has been major environmental change, but the primary cause seems to be boredom. Allowing unlimited scratching, option D, can lead to further damage to furniture and carpets. Question 19. David is an animal behavior consultant working with a family that has a dog, Bailey, who has developed aggressive tendencies towards visitors in the home. Bailey barks loudly and growls when new people enter, but will calm down and become friendly once they are settled in. The family is unsure how to address this behavior and wants to ensure that Bailey can behave more appropriately around guests. What should David recommend as the most effective strategy for managing this behavior? They advised the family to keep Bailey isolated in another room whenever visitors arrive, preventing any interactions to avoid aggression. B. Recommend implementing a desensitization plan, gradually exposing Bailey to controlled interactions with visitors and rewarding calm behavior with treats. C. Suggest using a shock collar to discourage barking and growling when new people enter the home, aiming to stop the aggressive behavior immediately. D. Recommend that the family increase the level of play and exercise for Bailey before visitors arrive to tire him out and reduce the likelihood of aggressive behavior. Answer. B. Recommend implementing a desensitization plan, gradually exposing Bailey to controlled interactions with visitors and rewarding calm behavior with treats. Explanation. Desensitization is an effective strategy for managing fear-based aggression and reactivity. By gradually exposing Bailey to visitors in a controlled manner and rewarding calm behavior, Bailey will learn that guests do not pose a threat, and that calm behavior results in positive outcomes. Isolating the dog, option A, does not help to address the behavioral issue and may increase anxiety. Shock collars, option C, can increase stress and worsen the aggression. Increasing exercise, option D, can help with overall behavior but does not address the specific issue of aggression towards visitors. Question 20. A client is experiencing difficulty with their dog Roxy, who has started exhibiting fearful behavior around loud noises such as thunderstorms and fireworks. Roxy shakes, hides, and tries to escape when these noises occur. The client is looking for a solution that would help manage and reduce Roxy's fear of loud noises. What is the most effective approach for addressing Roxy's noise phobia? A. Recommend the client try to desensitize Roxy to loud noises by playing recordings of thunderstorms or fireworks at low volumes, gradually increasing the volume over time while rewarding calm behavior. B. Advise the client to keep Roxy in crate during thunderstorms or fireworks, as this will reduce the opportunity for escape and prevent fear-based behaviors. C. Suggest using calming drug prescribed by veterinarian to reduce anxiety during loud noises, along with providing safe, quiet space for the dog. D. Recommend that the client ignore Roxy's fearful behavior and avoid comforting her when she is anxious, as this may reinforce the fear response. Answer A. Recommend the client try to desensitize Roxy to loud noises by playing recordings of thunderstorms or fireworks at low volumes, gradually increasing the volume over time while rewarding calm behavior. Explanation. Desensitization is one of the most effective methods for treating noise phobias. By gradually exposing Roxy to the sound at a low volume and rewarding calm behavior, she will learn that the noises are not a threat. A crate, option B, may create a sense of safety but does not address the underlying fear. Calming drugs, option C, may help manage symptoms but should be paired with behavioral interventions. Ignoring the behavior, option D, can actually reinforce the fear and prevent the dog from learning that the noises are not dangerous. Question 21. Emily has a dog, Max, who has recently started showing signs of resource guarding over toys and food. He becomes growly and defensive when people or other animals approach his possessions. Emily is concerned that Max's behavior may escalate, leading to aggressive interactions in the future. What should Emily do to address this resource guarding behavior in a safe and effective way? A. Recommend that Emily take away Max's toys and food whenever he exhibits guarding behavior in order to teach him that guarding leads to loss of resources. B. Suggest that Emily work on counter-conditioning by pairing Max's food and toys with positive experiences, such as treats and praise when others are near his possessions. C. Advise Emily to simply leave Max's food and toys alone and not intervene, as resource guarding is natural behavior that cannot be changed. D. Recommend using punishment-based approach, such as using an anti-bark collar or spraying Max with water when he shows guarding behavior. Answer: B. Suggest that Emily work on counter-conditioning by pairing Max's food and toys with positive experiences, such as treats and praise when others are near his possessions. Explanation: counter-conditioning is an effective method for addressing resource guarding, as it helps to change the dog's emotional response to the presence of others near his possessions. Taking away toys or food, option A, can increase anxiety and worsen guarding behavior. Ignoring behavior, option C, does not address the issue and can allow it to escalate. Punishment, option D, is not effective and can increase stress and aggression, making the problem worse. Question 22. A dog named Bella has recently started showing signs of separation anxiety. When her owners leave the house, Bella barks excessively, chews on furniture, and has accidents inside. The owners are unsure how to address the anxiety and are looking for a solution that does not involve medication. What should be the primary focus of the treatment plan for Bella? A. Advise the owners to leave Bella alone for progressively longer periods to help her get used to being alone and reduce her anxiety over time. B. Recommend that the owners provide Bella with a variety of toys and distractions to keep her busy when they leave the house, hoping to prevent destructive behaviors. C. Suggest using a crate to confine Bella while the owners are away, as this will help her feel secure and prevent accidents inside. D. Recommend a combination of desensitization and counter-conditioning by gradually increasing the time Bella is left alone while rewarding calm behavior. Answer: D. Recommend a combination of desensitization and counter-conditioning by gradually increasing the time Bella is left alone while rewarding calm behavior. Explanation: the most effective treatment for separation anxiety involves desensitization, gradually increasing the time the dog is left alone, and counter-conditioning, rewarding calm behavior. This helps Bella learn that being alone is not threatening and rewards her for being calmed. Separations: simply leaving Bella alone for longer periods, option A, without structured training can exacerbate anxiety. Providing toys, option B, or using a crate, option C, can help manage behavior in the short term, but do not address the root cause of separation anxiety. Question 23. Rita is working with a client who has a dog, Charlie, that becomes overly excitable and jumps up on people when they arrive home or when guests visit. Charlie's behavior is friendly but overwhelming, and the client is worried that it may lead to uncomfortable situations, especially with young children or older adults. What should Rita recommend as the most effective way to address Charlie's jumping behavior? A. Suggest that the client immediately push Charlie down or yell at him when he jumps in order to teach him that jumping is unacceptable. B. Recommend using positive reinforcement by rewarding Charlie with treats when he keeps all four paws on the ground during greetings. C. Advise the client to completely ignore Charlie when he jumps and only reward him when he sits or stands calmly to greet people. D. Recommend that the client put Charlie in another room when guests arrive so he can't jump on them. Answer: B. Recommend using positive reinforcement by rewarding Charlie with treats when he keeps all four paws on the ground during greetings. Explanation: positive reinforcement is the most effective way to teach Charlie to remain calm and keep all four paws on the ground. By rewarding calm behavior, the dog learns that staying grounded results in positive outcomes. Pushing or yelling at Charlie, option A, can be counterproductive and may anxiety or confusion. Ignoring him, option C, is a good strategy, but this should be paired with rewarding calm behavior, not just ignoring. Isolating Charlie, option D, does not address the behavior and may create more stress or confusion when interactions do occur. Question 24. Tom is consulting with a client who has a dog, Daisy, that has started exhibiting excessive barking at night. Daisy barks at shadows, sounds outside, and even when no one is around. The client is unsure whether this behavior is a sign of anxiety, territorial behavior, or something else. What is the most appropriate approach for managing Daisy's nighttime barking? A. Advise the client to bring Daisy into the bedroom at night so she can feel more secure and stop barking at shadows. B. Recommend that the client use citronella collar to spray Daisy whenever she barks at night to discourage the behavior. C. Suggests that the client establish consistent bedtime routine with Daisy, incorporating calming activities such as walk and puzzle toys to tire her out before sleep. D. Recommend that the client leave Daisy in the backyard overnight to help her feel more in control of her environment and reduce barking. Answer C. Suggest that the client establish a consistent bedtime routine with Daisy, incorporating calming activities such as a walk and puzzle toys to tire her out before sleep. Explanation. Establishing a consistent bedtime routine with calming activities is the best approach to reduce anxiety and promote restful behavior. A walk before bedtime can help Daisy expend energy, while puzzle toys can provide mental stimulation. Bringing Daisy into bedroom. Option A may provide temporary comfort but doesn't address the underlying cause of the barking. Using a citronella collar. Option B may not address the cause of the barking and can lead to further stress. Leaving Daisy outside. Option D is not recommended as it can increase anxiety and expose her to environmental stressors. Question 25. Samantha has recently adopted a rescue dog, Toby, who has a history of fear and anxiety. Toby tends to hide and tremble when exposed to new people or unfamiliar situations. Despite a calm home environment, he still appears to be overly anxious, especially during car rides. What is the most effective approach for helping Toby overcome his fear and build confidence in these situations? A. Suggest that Samantha immediately take Toby on frequent car rides to expose him to the experience and help him become desensitized. B. Recommend using calming aids, such as a pheromone collar or calming treat, to help Toby manage his anxiety during car rides. C. Advise Samantha to begin desensitizing Toby by gradually increasing the duration and frequency of car rides, pairing them with rewards for calm behavior. D. At Samantha keep Toby at home to avoid situations that trigger his anxiety, as it will prevent him from becoming stressed. Answer. C. Advise Samantha to begin desensitizing Toby by gradually increasing the duration and frequency of car rides, pairing them with rewards for calm behavior. Explanation. Gradual desensitization combined with positive reinforcement is the most effective way to help Toby overcome his fear of car rides. By pairing these experiences with rewards for calm behavior, Toby learns that car rides are not threatening. Taking him on free car rides too quickly. Option A may overwhelm him and worsen his anxiety. Calming aids. Option B can help manage symptoms, but they do not address the root cause of the fear. Keeping Toby at home. Option D does not allow him to learn how to cope with anxiety triggering situations. Question 26. Henry's dog Max has been experiencing difficulty with leash pulling during walks. Max pulls so strongly that Henry has trouble controlling him, making walks unpleasant. Henry is looking for an effective method to reduce this behavior and improve their walks together. What is the most effective solution to address Max's leash pulling? A. Advise Henry to pull back on the leash to correct Max's pulling behavior, as this will teach him to stop pulling. B. Recommend using harness that tightens around Max's chest when he pulls to prevent him from pulling further. C. Suggest training Max to walk politely on leash by rewarding him with treats and praise when he walks calmly by Henry's side. D. Recommend that Henry stop walking whenever Max pulls and only resume walking when Max is to reinforce that pulling stops movement. Answer. C. Suggest training Max to walk politely on a leash by rewarding him with treats and praise when he walks calmly by Henry's side. Explanation. Positive reinforcement is the most effective method for teaching dog to walk calmly on leash. By rewarding Max with treats and praise for walking calmly, Henry will encourage the desired behavior. Simply pulling back on the leash. Option A can create frustration and confusion, leading to more pulling. Harness that tightens when Max pulls. Option B may limit pulling in the short term but does not address the root cause of the behavior. Stopping when Max pulls. Option D can be helpful as part of training but should be combined with positive reinforcement to teach calm walking. Question 27. Anna's dog, Daisy, has started to exhibit aggressive behavior toward other dogs while on walks. Daisy growls, barks, and sometimes lunges at other dogs, which makes Anna anxious and unsure of how to handle the situation. What is the most appropriate course of action to safely address Daisy's aggressive behavior toward other dogs? A. Recommend that Anna avoid walking Daisy near other dogs to prevent any aggressive encounters. B. Suggest that Anna use a prong collar or choke chain to correct Daisy's aggressive behavior when she reacts to other dogs. C. Advise Anna to gradually desensitize Daisy to the presence of other dogs by rewarding calm behavior and increasing exposure over time. D. Recommend that Anna give Daisy treats whenever she reacts aggressively toward other dogs. Distract her and stop the behavior. Answer. C. Advise Anna to gradually desensitize Daisy to the presence of other dogs by rewarding calm behavior and increasing exposure over time. Explanation. Desensitization is the best approach to addressing aggression. By gradually exposing Daisy to other dogs at a distance where she remains calm and rewarding her for that calm behavior, Anna will help Daisy learn to tolerate other dogs without reacting aggressively. Avoiding other dogs, option A. Reduce immediate stress but does not address the underlying problem. Using a prong collar or choke chain, option B, can escalate aggression and stress, making the behavior worse. Rewarding aggressive behavior, option D, reinforces the unwanted behavior and does not solve the issue. Question 20. Sarah has recently noticed that her dog, Rocky, has started exhibiting signs of excessive licking, particularly on his paws and legs. Rocky licks these areas frequently, leading to irritation and sometimes redness. Sarah is concerned that this behavior may be caused by anxiety or an underlying medical condition. What is the most effective course of action for addressing Rocky's excessive licking? A. Advise Sarah to ignore the licking behavior and avoid drawing attention to it, as this will eventually make Rocky stop. B. Recommend that Sarah schedule a visit to the veterinarian to rule out any potential medical conditions, such as allergies or skin infections. C. Suggest using an anti-licking spray to deter Rocky from licking his paws and legs. D. Advise Sarah to provide more exercise and stimulation to help alleviate potential anxiety that be contributing to the licking behavior. Answer. B. Recommend that Sarah schedule a visit to the veterinarian to rule out any potential medical conditions such as allergies or skin infections. Explanation. Excessive licking can be a sign of an underlying medical issue such as allergies or skin infections. It is important to rule out these possibilities first by consulting a veterinarian. Ignoring the behavior, option A, can lead to further irritation and worsen the condition. Anti-licking sprays, option C, may provide a temporary solution but do not address the root cause, while increased exercise and stimulation, option D, can help alleviate anxiety. It is more important to first ensure there is no medical issue contributing to the behavior. Question 29. Jill is seeking advice for her dog, Rufus, who has recently started showing signs of fear-based aggression toward new people. Rufus barks, growls, and shows signs of defensive aggression when someone unfamiliar approaches him. Jill is concerned about potential safety risks and wants to help Rufus become more comfortable around strangers. What is the most effective approach for addressing Rufus's fear-based aggression? I advise Jill to allow Rufus to continue displaying his fear-based aggression without intervention, as he will eventually get used to new people. B. Recommend using positive reinforcement to reward calm behavior when new people approach, gradually increasing exposure to strangers over time. C. Suggests that Jill immediately correct Rufus's aggressive behavior by using a shock collar when he reacts to strangers. D. Advise Jill to restrict Rufus's exposure to new people and avoid situations that might trigger his aggression. Answer. B. Recommend using positive reinforcement to reward calm behavior when new people approach, gradually increasing exposure to strangers over time. Explanation. Positive reinforcement combined with gradual exposure is the most effective method for addressing fear-based aggression by rewarding calm behavior and increasing exposure to new people in a controlled manner. Jill can help Rufus build confidence and learn to respond appropriately. Allowing Rufus to continue displaying aggression without intervention, option A, can worsen the fear-based behavior. Using a shock collar, option C, is inhumane and can escalate anxiety. Restricting exposure, option D, may provide temporary relief but does not help Rufus learn how to behave in these situations. Question 30. Melissa has a dog, Buster, who has developed a habit of chasing cars during walks. Buster's behavior has become increasingly dangerous as he tries to run after moving vehicles, and Melissa is unsure how to stop this behavior and prevent accidents. What is the most appropriate way for Melissa to address Buster's kart chasing habit? A. Advise Melissa to immediately correct Buster's kart chasing behavior with firm no and tug on the leash when he tries to chase cars. B. Recommend that Melissa take Buster to fenced area to allow him to safely release his energy and prevent him from chasing cars. C. Suggest that Melissa use long leash and reward Buster for focusing on her rather than the cars, gradually increasing the difficulty of the training. D. Recommend that Melissa avoid walk Buster near busy streets to prevent car chasing incidents from occurring. Answer. C. Suggests that Melissa use a long leash and reward Buster for focusing on her rather than the cars, gradually increasing the difficulty of the training. Explanation. Using a long leash and rewarding Buster for focusing on Melissa instead of the cars is an effective way to train him to stop chasing Gradually increasing the level of distraction and rewarding calm behavior will help Buster learn that paying attention to Melissa is more rewarding than Cars correcting the behavior with a tug on the leash option A may cause confusion or anxiety. Taking Buster to a fenced area option B may provide some relief but does not address the behavior. Avoiding busy streets option D does not solve the problem long term and limits training opportunities.